If you've tried everything under the sun and nothing seems to be working for your stretch mark, what I'm about to share with you would actually blow your mind. So stick around. Stretch marks are not just skin deep. They happen when collagen and elastin snap due to overstretching. Collagen is responsible for the texture, the structure, and giving your skin strength, while elastin is responsible, just from its name, giving your skin its elasticity. That is allowing your skin to stretch and to also recoil like rubber. Okay, it's more like you pinching your skin right now and releasing, and immediately you release, see that your skin goes back to its normal shape. That's the work of elastin. But when these two gentlemen, these two proteins, when they are overwhelmed, that is when you see stretch marks occurring. And the funny thing is, when stretch marks occur like that, you need to give them a fight before they actually go, because they don't go easily. And an African adage says that one who does not know what is troubling him does not seek a cure. And that brings us to, what are the possible causes of stretch marks? Number one is pregnancy. When you're pregnant, or when a woman is pregnant, she's carrying like 2, 3 or 4 kg extra load in her body, so her skin stretches in order to accommodate this load. And that's why for some of them you would often see stretch marks on their boobs or on their stomach. Another reason is overweight. Just like women who are pregnant, when you're overweight, you're like carrying extra kg of fat in your body, and your skin has to stretch in order to accommodate that extra load. And that's why more often than not you would find people, it's a predisposing factor to you having stretch mark. Another one is, I have seen countless number of people say this: oh, I use triple action cream, I mix it with my cream, and I use as my normal body cream. This act is actually very dangerous if you want to keep your skin intact, because most triple action cream have what we call a steroid. It could be dexamethasone steroid, it could be triamcinolone steroid, and we know that steroid thins the skin, disrupting the elastin and the collagen structure in your body, and this can predispose you to stretch marks. Another one is family history. If your mom has stretch mark or your dad has stretch mark, there is every possibility that you might have, because they have. And one other funny one is being a female. The female skin is actually thinner than that of the male. The male skin is actually more fibrous and more stubborn than that of the female, and this thinness is a predisposing factor to you coming down with stretch marks. And again, the female body has more cortisol, which is a stress hormone, than the male. And cortisol is a steroid, and steroid thins and disrupts the collagen and elastin level in your body. So this is the part that everybody has been waiting for, the management part or the treatment part. So many people have used all manner of things to try and manage their stretch marks. Some people have used shea butter, some people use coconut oil, some people have used so many things. But I'm going to be sharing with you 2 pharmaceutical ingredients that have been scientifically proven to take care of your stretch marks. Number one is Tretinoin. 0.1% Tretinoin cream has been proven over time to help heal and fade away the scars that stretch mark causes. How does Tretinoin do this? Okay, Tretinoin helps in boosting your collagen level. And you remember when we said about collagen and its relationship with stretch mark. So what Tretinoin does is to boost and help your body to generate new collagen. And also Tretinoin helps your body in shedding old skin. Another one is hyaluronic acid. So hyaluronic acid, what it does is that it helps your body to plump, helps keeps your body hydrated, and it helps your body to also heal. But here is the truth: using a combination of Tretinoin and hyaluronic acid has proven to be much more effective than if you use Tretinoin and hyaluronic acid. You tend to get quicker results and faster results. But that is not all. This is a bonus tip that I'm about to share with you, and I'm sharing with you because as my viewers, you deserve to actually have a glowing skin. So you combining these creams, because most times hyaluronic acid can actually come as a serum, but most times we'll have it come as a cream. So if you're applying that and you're also applying tretinoin, you can combine it with oral collagen. So what an oral collagen will do is that it will help to scale up the collagen that your body is already producing and help your skin to maintain its structure and texture. But I would like to say this, Stretchmarks does not just go overnight, so you have to exercise patience when you start using these pharmaceutical products. All right, we've come to the end of our talk today. I hope you gained something. I would implore you to subscribe to this channel, because I'll be bringing you much more health tips in the days to come. Thanks for watching. You can also share these tips with your friends who are going through or who are suffering from stretch marks, because one of the things that stretch mark does is that it puts off people psychologically. Thank you for watching. I'll see you in my next video. Bye.